right, which of the following ovarian tumors is most consistent with this patient's presentation? So it's thecoma, granular cell tumor. Okay, so all these ovarian tumors. 48-year-old woman presents to her gynecologist complaints of menstrual irregularities and excessive uterine bleeding. She also reports recent development of facial hair and deepening of her voice. Pelvic examination of ultrasound in her left ovary. Histological examination mass shows abundant lipid-filled spindle-shaped cells. Which one ovarian tumor? Okay, so the Krukenberg tumor, I usually think something with like a big belly. That's nothing is describing that. Granulosa cell tumor might be a little young. Let's see, facial hair and deepening of her voice. Eco makes sense here. Dysgerminoma. Abundance of lipid-filled spindle-shaped cells. Nothing is really coming for that. Facial or deepening of voice, I think like PCOS, but that's not really what they're talking about. They're talking about ovarian tumor. So I think possibly the deepening of the voice, facial hair could be increased in testosterone. HFSH, not sure. Cystadenoma. Asthma left over. Oh, it's a lipid filled. Okay, so lipid filled and with the, I think it's something that's gonna put off a lot of hormones here. When we're in the ovaries, that makes sense. I'm just not sure. Abundance of lipid filled spindle shaped.
Okay. What do you want to go with? Yeah, go ahead. What's your guts?
Again, yeah, and I'm not too sure with any of this. Granulosa cell tumor, I think she's too young for. Krukenberg, no. This germinoma, I don't really remember what that is. I would go with thecoma, but I'm not, again, very low confidence on this.
Okay, so let's walk about it.
Okay.
Menzies irregularity, excessive hair growth, deepening, mass in the left for hormone producing ovarian tumor. So
Mm-hmm.
you know it's hormone producing because it's messing with
Correct.
it, right? Thecoma, which is a sex cord stroma that produces estrogen and can cause virilization.
Utilization. Okay.
Yeah, granulosa cells produce estrogen, but typically presents with endometrial hyperplasia and postmenopausal bleeding.
Okay.
It's usually characterized by Call Exner bodies, which are small gland
Mm-hmm.
structures, use synophilic fluid. Krukenberg tumor, right? Metastatic ovarian tumor, usually in the GI tract, like you said.
Yep.
Dysgerminoma, malignant
I didn't
germ
remember
cell
what that was.
tumor,
Okay.
affects young women, not
Okay.
associated with hormone production, so you know it can't be here. Mucocystadenoma, benign epithelial tumor that's filled with mucin producing cells, but doesn't produce hormones. So you should have gotten it between, thecoma and granulosa cell tumor, right?
Mm-hmm.
And then due to kind of virilization, and then also the lipid filled spindle cell fibers, that's going to be better with the coma.
Okay.